Well, I'm going to start, and this is about trying to get the governor to apply for federal funds that we think are good for the state. If you read this morning's newspapers, you will see that the governor has said, governor's spokesperson said, he is striving to find a way to stop and then the implementation of health reform in Minnesota. He's also turning down lots of federal money that ought to be spent here. I think this is a very sad day in the history of Minnesota when we have a governor that says that Minnesota taxpayers that send money to Washington shouldn't get that money back and have it spent in Minnesota. We are sending a letter to the governor requesting that he apply for the money for setting up an exchange in Minnesota, which his own Governor's Transformation Task Force in 2008 recommended that we do. We don't know if he's going to apply for that. It's $1 million. He has to apply by tomorrow. If we don't set up that exchange, the federal government will come into Minnesota and set one up themselves. So we need that money so that we can keep control of our health care in the state of Minnesota. The governor talks about a federal takeover of health care. That is not the case in the federal law. There are many, many things in this law that give states the opportunity to control their own futures. We have here a list of projects, some of which he has already rejected. I'll just talk about one, and that's the federal grant to prevent excessive health insurance premium increases. The Department of Commerce filled out the application, sent it to the governor, and he refused to sign it. We currently have a system very similar to Wisconsin for regulating health insurance premiums. Wisconsin applied, they're getting the money, and they're going to use that federal money to improve the way that they regulate insurance rates. Our governor has chosen to basically have Minnesota taxpayers pay for what Wisconsin is going to do. These are, again, opportunities for us. If you look at the early enrollment in medical assistance, which the governor has refused to do, we have put in state law that the next governor can apply, but the Governor Pawlenty is costing the healthcare providers of Minnesota $1 million a day because we're not doing early enrollment in medical assistance. This is basically the general assistance Medicare population, and we could be, or our providers, I mean, just look at the newspaper. This week, Children's Hospitals laid off 250 people because of the high enrollment of medical assistance people in their program. This is an example where we could increase jobs. It's $1 million a day. We estimate that that would be about 23,000 jobs in Minnesota at a time when Minnesota drastically needs jobs. And I will finish, there are some things in the healthcare reform bill that he can't repeal or he can't ignore. They're going to happen. The federal law is the federal law. That includes guaranteed issues, so that if you have a pre-existing condition, you will still get insurance in 2014. We have that going into effect right now for kids up to 16. The governor can't repeal that. He can't repeal the tax credits that are going to small businesses this year if they help their employees get health insurance. He can't repeal the closing or the partial closing of the donut hole for Medicare enrollees. And he can't repeal the law that says if you have children up to 26 years of age that do not have other choices for insurance, they can still remain on their parents' insurance. He can't change those. This, as I said, is a sad day for Minnesota. I think we have a governor that wants to be Minnesota's next Harold Stassen and spend the rest of his life running for president unsuccessfully. Senator Bergman.
Thank you very much. It's very disappointing to hear the governor issue an executive order to his departments not to apply for any federal funding that they might be able to get for the citizens of the state of Minnesota. One of the things that many of us have been looking forward to is having the federal government be our partner in the reforms that we've passed in 2008 when Governor Pawlenty signed a health care reform law. We've been looking forward to having the federal government be a partner with us in payment reform. We've been looking forward to having an exchange where the citizens of Minnesota can understand better how to get the most value for their insurance dollar by getting the lowest premium and the highest quality care. We've been looking forward to having an exchange where businesses can help can understand better how to get the tax credits that they are entitled to by the federal government and get more people enrolled into health care through private policies that their employers would provide for them. It is hard for me to understand why the governor would want to turn his back on these opportunities. These are building on things that Minnesota has already started. Oftentimes he likes to talk about how Minnesota is ahead of the rest of the nation because of the things we've done so far. Having the federal government be our partner in these things will only help improve the work we're doing and the direction we need to move. So it's very disappointing to hear that we're not going to be applying for things. Now, it's not entirely clear what we're not going to be applying for. The law that was passed this year, the budget bill, except for the Medicaid buy-in, which we acknowledge the governor can block by executive order, but the other grant opportunities, many of them were stated in the law that they would be applied for. And so it's not clear to us whether he will be applying for those or not. I'd like to turn it over to my colleague, Representative Thiessen, to talk about what some of those are.
Well, thank you, Senator. And although it is disappointing that the governor is taking this position, like much of what this governor has done through his 8 years in office, so it's a lot of political theater with not much real meaningful impact. We required in law that he has to apply for this insurance exchange that Representative Huntley referred to. And if he doesn't, he'll be violating Minnesota law. And so we expect that tomorrow he will be submitting that application. We did have in the law requirements that he apply for grants for healthcare teams to support healthcare homes, something that we've done a lot of work on in Minnesota. We required that he apply for grants related to pediatric accountable care organizations, again, something that we've been moving forward on in Minnesota, for the prevention of chronic disease, a huge challenge facing our state and many other states. On payment reform, we require him in the law that he has to apply for grants related to improving how we pay for health care to get the best bang for our buck. And emergency psychiatric grants, another huge challenge that we're facing in Minnesota. We are way behind in terms of the psychiatric services we provide the citizens of Minnesota. These federal dollars, which we required in law that he apply for, will help us actually start to close that hole, which is really one of the stains on Minnesota's healthcare system. And so, for all that it's disappointing the governor has resisted federal health care reform, rejected the early Medicaid money, rejected money related to the MCHA program in the past. A lot of this with him having only 4 more months in office. There's little, fortunately there's the damage that he can do in the next 4 months is limited, and I'm pleased about that. And I would encourage him to follow Minnesota law and actually requires departments to apply for these grants.
I'm Erin Murphy. While I agree with Representative Thiessen that the governor's efforts on this front are largely theatrical, his refusal to engage in early medical assistance has a real cost for Minnesota. It's a $1.4 billion source of revenue that would go to hospitals, to doctors, to nurses, and it would provide for at least 20,000 jobs in Minnesota over the next 3 years. There are more than 200,000 people in Minnesota without work right now. And because of politics, the governor is refusing to move forward with not only an opportunity for many people to go back to work, but also the best opportunity for us in Minnesota to put our fingerprints on reform going forward and actually do the hard work to rein in cost growth going forward so we can continue to have good schools and a clean environment and lower property taxes. The Republicans' mantra this summer, over this long, hot summer, has been just say no. Just say no to the opportunities facing us in Minnesota. And we are here to say that we are going to continue to work hard to confront the real problems we face and bring real solutions. And I hope you'll be with us on that. Thank you.
I'm John Marty, and I want to add only one thing, and that is that there's nothing the governor can do to stop the federal health reform from happening. There are 21 states suing. Even they are taking the money from the grants. The only thing he can do is starve Minnesota from money that our taxpayers have been paying our fair share to the federal government. We ought to get our fair share back. Other states are applying for the grants. Even the states that have been suing the federal government, he can't stop it. All he can do is punish our people by taking money away, and that's lunacy.
Other
Do you want
questions?
to address turning away sex ed dollars and taking abstinence dollars instead?
I'd be happy to. I've carried some of the sex ed legislation in the past, and there's no logical reason for doing that. If we want to prevent unintended pregnancies, if we want to prevent sexually transmitted infections, we need the sex ed dollars. And we ought to be using it, and we know he's trying to make a political point. I mean, you can read the surveys. University of Minnesota surveys suggest 90+% of Minnesota adults across the board, this is every congressional district, everywhere in the state, supports comprehensive sexuality education. I know there's 8 or 10% of the people who don't, and maybe he scores political points with them, but why we should be doing that, putting our young people at risk, I think that's foolish, and I think we've got to turn that around.
Does anyone have a handle on how much money is out there in grants that the state has yet to apply for or couldn't apply for under this executive order?
We haven't added it all up, and since we're not sure if he's going to follow the law and apply for the things that the law, Minnesota law requires him to apply for, it's hard to give you an estimate, but we know that it's over $50 billion, and that doesn't count the Medicaid money for early enrollment.
And you said I'm sorry, go ahead.
What was that figure again?
Over $50 billion.
What does that include? All federal?
That's nationally.
Okay.
And do you know what
Is it-
Minnesota's share would be of that if Minnesota applied for everything?
No.
And they're competitive grants, some of them, so it's hard to. Well, I think we're going to circulate, though, a list of the grant opportunities to you.
Which is different from this 1.7 billion?
This is what he's already turned down for sure.
Except for the bottom two. We don't,
And the exchange is required by Minnesota law.
Yes.
Yes, it is. So
For the FMAP, is it?
the FMAP is not, the governor chose not to do it during his administration, but the next governor coming in can do it, but he
Well,
can't get it.
each day, the governor could
Yeah.
choose to apply for that money. The law allows him to apply for the money. The money has been appropriated for the state share. All he needs to do is allow the application to go in. Each day that goes by, he has said he is not doing that. He could change his mind.
To clarify on the FMAP, though, that's not federal health care. That's not the Affordable Health Care Act. That's the stimulus package. So his executive order wouldn't cover this FMAP extension.
We aren't sure what he's going to do with the FMAP, but he does have to sign an application to get that money, whereas earlier FMAP dollars he did not.
He has to apply by September 24th for that money, and he has to apply by tomorrow for about $160 million for education, which goes not to the state, but goes directly to school districts.
And so you don't know,
And those are
the
both-
breadth of what this could cover. It could be multiples of the 1.7.
Oh, yes.
What's the highest it could be? Any?
Representative Thiessen, could you explain the political theater aspect that you referenced? What do you think the governor is trying to do?
Well, clearly it's to his advantage as he's running for national office and appealing to the Republican base to be an opponent of the Affordable Care Act. And by making this gesture of issuing this executive order, where we've already, in law, he's got to apply. And in fact, if you look at the executive order, it says, I will apply for the ones that the legislature said I have to apply for. What's left for him to apply for is actually not clear over the next 4 months. So will Minnesota actually be losing out on these dollars is not clear. I mean, to some extent, it's what he's done over and over again throughout his administration, which is to make a big public splash about doing something, but there's no meat behind it. And I think that that may be the case in this situation as well. But it's to advance his presidential ambitions and to play to the folks that are going to, that arguably could put him in the place of being the Republican candidate for president in 2012.
So I'm clear, the executive order in which he uses the word Obamacare is political. That's a political word to you.
Yeah. Yes.
It's in there again and again.
It's in there again and again, yes.
And using that word is political to you, but it's your contention that he may not have the authority to apply over the next 4 months for the number of grants, just because of the timelines?
It may be that by the time he leaves office, we'll still have the opportunity to apply for many of these grants. So what the real impact would be is not entirely clear, particularly because the legislature had the foresight, and particularly Kate Perushek, who helped, my assistant, to have us put into law that we have to apply for many of these grants.
And yet some of you, including Senator Berglund, is suggesting that he may, even though the law requires him to do it, he may not do it anyway.
He may not. I mean,
What do you do
it
then?
wouldn't be the first time that he hasn't been exactly following the law.
Correct.
What do we do then? Well, we'll have to decide what to do then. I guess the question is, what is he not applying for, and is there another opportunity to apply for it in a short time or not? All of those things would be considerations about what to do if the governor is not following the law.
Well, what are your options if he doesn't apply for measures that are required to be applied for in the court?
Well, the court could order the departments to make the applications.
If somebody sues them.
Would the legislature take him to court?
I think that would have to be an assessment we would make when we know what he's going to do.
Senator Marty, you said that even the states that have sued over the healthcare reform package have accepted this money. Do you know if any other states have gone to the length that Pawlenty?
I'm not aware of any states that are just saying, we don't want the money. I mean, that's what he's saying. I mean, the grant that Representative Huntley mentioned a few minutes ago, the Commerce Department $1 million one, that one had a deadline. It's gone. It was automatic. All but 4 states or so applied, and they all got the money. It was $1 million guaranteed. We just had to fill out the paperwork. The department did it. He refused. So again, of those 21 states that sued, Minnesota wasn't. So at least all but 3 or so of them had to be the ones had to be applying for it. So they sue the government, but they're not foolish enough to turn down the money.
Representative Thiessen, can I just follow up on what you said about writing a lot of this into the state law? How much of it is written, and where do you think you might have missed it?
We can get you the language of the legislation. So it's written into the budget bill. Is that, I don't know what you're asking particularly, but that right there.
And do you, is there anything out there of the magnitude of the potential size of the early expansion of Medicaid, or is that by far the biggest pot of money out there?
As an individual piece of money, that is by far the biggest piece of money out there.
Can you share that along with the rest of the class?
Sure.
You remember, the early MA is what we put in the bill that would be up to 75% of poverty for adults without kids, which is the same criteria we used to have for GAMC. That bill would allow the money to come into our healthcare providers. It does not go to the state. It doesn't fix our bottom line. It goes to healthcare providers that currently, because of the environment, are having to lay off employees. And this is the worst time in the world to be laying off employees.
Representative Murphy, you were at Regions this morning, weren't you? What did you learn from hospital executives about the healthcare turnback?
We've been touring hospitals and meeting with providers in different parts of the state so that we can learn what we think might be working going forward as a result of the GAMC law passed this session and what's not working. I am happy to say that Regions is working to try and develop some innovative methods to coordinate care. And I think that's very important with the sick population. But they were also very clear that they believe they would be able to do that same care coordination and do it more justice if they were able to do it in early MA, if we were able to enroll in MA. And we know that because of the way the GAMC law has been implemented, that there are many, many Minnesotans who would be eligible for GAMC who are not going to be able to see a provider. And the maldistribution of the delivery system is causing a lot of hardship for both providers and for enrollees across the state. And so I think there are going to be important lessons for us about what's working and what's not working and where we can make reform in the future. But what is clear to me is that we can't just cut a health care program and say we've solved our budget problem. Because if we just cut the health care program, the costs are going to be shifted someplace else. The providers are going to do their best to provide care for people, even if they're not being reimbursed, but we also know that providers are making decisions not to provide care. And that's not what a safety net is. So I think we're going through a long experiment this summer that's going to teach us some important lessons about healthcare delivery and reform and about Minnesota itself.
There are some polling out there, Kaiser Family Foundation just said, released a poll saying that about 43% of the public supports the federal health law. Isn't the governor just pretty much doing what the public wants and just kind of rejecting these items?
Tom would like to answer that.
That is true. Actually, the number approving is starting to go up. But if you ask specific items about the bill, the only one that the public is opposed to is the mandate for individual insurance. Every other part of the bill is supported by the public by much more than 50%. Should we get rid of pre-existing conditions?
70%
Yeah.
approve.
So if you ask all the things that are in the bill, the only one that the public doesn't like is the individual mandate.
And
Can I just follow up to say that I think it's our job as policymakers to make sure that citizens understand what's at stake. And for the pieces of the Affordable Care Act that are not yet clear to them, we need to make sure that they understand what it means, what benefit it's going to bring to Minnesotans, and what it means in terms of growing cost in the future. And when we're able to do that, and we are doing that, I think more and more Minnesotans and Americans are going to support that piece of legislation. That's our job, and that's one of the reasons why I'm frustrated with the governor, because I think he's playing to a base that is very extreme, and he's not serving the future interests of either Minnesota or the United States.
Yeah, Tom, it doesn't matter. It doesn't matter if anybody supports it or not. The question is, do you turn down the money or not? The plan is going ahead. It's a question, do we want to turn down our share of the money that our taxpayers paid for it? Why should we turn down the money when the other states are taking it?
Then could one of you translate, if indeed all of this happens, plus some of the more possibilities, how will Minnesotans feel the difference? Is it just a bottom line question for the state, and so cuts will have to be made elsewhere? Will there be individuals who are not receiving health care?
none of these grants have anything to do with the individual mandate. So turning down these grants is a very foolish thing to be doing. Turning down the grants will make it harder for Minnesota to control healthcare costs in the future. Turning down the grants will mean that we'll be behind other states in our ability to produce certain good outcomes. It just doesn't make sense. And one of the things I wanted to say in regard to general assistance medical care, we do not expect any more hospitals are going to be applying to be coordinating care organizations. The 4 hospitals that have applied expect that they are going to be out of slots by December, after which time then Minnesotans who need health care are not going to be able to get anything except emergency room care and prescription drugs.
Let me just add another item is whether you're talking about GAMC or the other public programs, if we don't pay for them through the state, they will still be treated in the hospitals. So we went over to Regions this morning. They're losing a lot of money to take care of these people because the GAMC program does not reimburse them what it actually costs. They're doing a great job, but they're losing money. Now, what happens when a hospital or health system loses money? They either go out of business or they
Pass it on to the rest.
pass it on to other people. They raise the rates they charge everybody else. So we're all going to pay for it anyway. Question is, do you want to pay for it in the least efficient system, or do you want to pay for it in the most efficient system?
In your list here, other than FMAP, how much would the state have to pay in matching grants, in administration costs, or how much would counties pay? A lot of times, as you know, federal money comes with strings. How much would states and state and counties and any other subdivisions pay?
Okay, if you just look at the early enrollment, that's the big dollar one. We're already in the state budget paying $1.2 billion for these people over the next 3.5 years. We're already paying that amount of money. Okay? To get the feds to come and pay 50%, we have to spend another $188 million. That was in the budget. It was approved. So for that $188 million additional dollars, our providers would have seen $1.4 billion in increased revenue for their hospitals. The other things are just grants, and in most cases, they do not have matching dollars. If you look at the sex ed one or personal responsibility bill, that was all federal money, no state money. The one the governor chose to fund actually requires more state money than the feds would give us.
And one other,
Would there be administrative costs? Not necessarily matching funds, but would the state have to pay to administer these grants? Or is that included in the grants?
Well, most of the grants have already been written by the departments, and they're ready to go in. It's just the question of whether the governor will choose to send them in.
well, and
So there is not any administrative costs going on here that would be expended otherwise that haven't already been expended.
And one other point, the opposite is actually happening with the extension of FMAP, because that is actually increasing the federal share from 50% to 60+%. So our match is actually going down if we were to apply for that grant. So he's passing up money that we're for sure going to be spending.
Could you contextualize for this? Has any other previous governor of Minnesota turned down this many resources for his constituents?
No.
Not that we know of.
You know, the status quo in healthcare cannot continue. Our economy as a nation will collapse if we don't change what we do in healthcare. And these grants would help the state of Minnesota, again, lead the rest of the country in having the best healthcare at the lowest cost. The governor says, no, the status quo is just fine.
Thank you very much.